This portion of Local Lifestyles is sponsored by HPC of Western Kentucky.
November is Hospice and Palliative Care Awareness Month, and it's a time to learn about the work being done locally in hospice and palliative care. Brenda Knolenberg is the CEO of Hospice and Palliative Care of Western Kentucky. It's good to see you again.
It's good to be here. Thanks.
You know, all year long, 24 hours a day, the work is being done. And I think in your experience and mine, people don't really always know about what palliative care is.
Right.
We hear the word hospice and we think we understand what the work is, but there are lots of kind of myths around both of those services.
Right. One of the things that we try to do at HPC is educate people, and this is actually National Care at Home Month. They've changed the name. It used to be National Hospice and Palliative Care Month, and actually Hospice Week is November 11th through 16th, so we have hit the nail on the head with being here this week.
Exactly.
And it's also Nurse Practitioner Week, and you talked about palliative care, and our nurse practitioners work a lot with our palliative care program, and that's for people with a chronic illness. It might not be a terminal illness, but a lot of symptom management, pain management that goes along with that, and we can help in the home with that with our palliative care program.
And then hospice what is the difference in hospice care?
The difference with hospice care is you must have a terminal diagnosis, which means your prognosis of your disease, if left to run its normal course, that it would be 6-month or less prognosis. And you can't be seeking aggressive treatment, whereas palliative care you can still be.
You're still having treatment?
Yes, definitely.
And so, this is such a confusing time for family members and for people who have either one of those conditions in life. So how do you help your clients and their families navigate these troubling waters?
Well, it is difficult, and it's always a difficult time, when you've got a loved one that is very ill. And so we have nurses, chaplains, social workers, aides that go into the home that help them. Our social workers can work on a lot of paperwork and things like that have to be filled out, and our nurses go in and just really teach the families how to care for their loved ones when we're not there, because we're not in the home 24/7, and actually most of our patients are in their homes.
And I thought that was a surprising statistic when you and I had talked in the past, that more people are opting to spend those last days and weeks at home, which makes total sense.
Right, yeah, because that's where they've lived their whole life. And they're comfortable there, they want to stay there, they want to enjoy their family there. And sometimes people think, oh, hospice care is just the last 2 or 3 days, and that's not the case. The hospice Medicare benefit is a 6-month benefit, and then you can recertify if you are still meeting the criteria of hospice. So, some of our patients are on longer than 6 months, and that's when we can really help them and help their families.
It just really is a vital service. So do we have to have a recommendation from a physician to come to you?
No, anyone can refer someone for hospice care. So a family member, a friend, anyone. They just need to call our office and say, hey, I want mom or dad or my son or daughter, whoever it might be, to come and be evaluated for hospice. And there is no cost to that. We come out and evaluate, and if the patient is appropriate, we can admit them and serve them and their families. We are on track to serve a record number of people this year. I just found out we've served 861 patients and their families.
That's just a phenomenal number for families, but it's great comfort too. Now there's a memorial service or a service of remembrance coming up.
Yes, so one of the things that we offer to families is bereavement care, and around the holidays, it's really difficult for families that have lost a loved one. And so on December 8th at 2:30 in the afternoon at the First Christian Church in Owensboro, we will have our service of remembrance, and it's open to the community. Anyone can come to remember a loved one that they have lost. And it's just wonderful. Your loved one does not have to have been served by hospice. It's for anyone, and it really helps to remember that loved one going into the holidays.
Yeah, and if you're hesitant about attending that service, believe me, you will be comforted when you come and see all those other people.
It is a wonderful service.
Brenda, thank you
for
the work you do. Appreciate you. We'll be back with more Lifestyles right after this. Stay with us.
This portion of Local Lifestyles is sponsored by HPC of Western Kentucky.